A survivorship care plan is a tool that when the Institute of Medicine came out with their major report in 2005, 2006, in their Lost to Transition report, they recommended that all patients receive a document that reviewed the treatment summary of what they went through, as well as what the surveillance plan for follow-up was going to be, as well as what to look for to report any problems, and what patients are telling us they also want content around health promotion. Well, going into their treatment, they should be asking for a written treatment plan. And that's not part of all these recommendations, but it's what our patients have told us in focus groups and study after study. They would like to have a written plan of, this is your diagnosis, this is what we're going to be doing for your treatment, whether it's surgery, radiation, or chemotherapy, and about how long it's going to last. The treatment summary is a document as part of the survivorship care plan that goes through what actually happened. So treatment may have changed, it may have stopped early, it may have gone on longer. It actually documents what occurred. And I find that when I give it to patients, it's also a good time to review their actual diagnosis, because so much happens during all that time, you forget the details. So the treatment plan is the first part that people should be asking for in writing. But the survivorship care plan is the treatment summary of what actually happened, and then the care plan for what's going to happen next. The intent is for people who end treatment. There's needs for people who don't end treatment. There are some diseases where you continue on treatment for years, or for the rest of your life you'll be taking a pill or whatever. And for people who have advanced cancer that may not stop treatment, there's still the need to have something similar to that. If you go by the definition of survivorship, which is anybody who's been diagnosed for cancer, a lot of the survivorship care plan's been working on people who have limited disease who end treatment. But in fact, this is needed by all survivors, regardless of their disease state. Well, there's basically two components. One is the treatment summary, and that should include their actual diagnosis, date of diagnosis, and some details about it. And it doesn't have to be a copy of the medical record, because you have a medical record, but it should be at least some high level that if you were going to see a new doctor or for your primary care provider, you could pull out this one page of your treatment summary and show it to people and not have to go through that all over again explaining what happened. The second part of a survivorship care plan is the what's next piece. And part of that's the surveillance of, you're going to have these tests this often for how many years. For colon cancer, it may be that you're getting a blood test for a CEA, tumor marker levels every 3 months for the next 2 or 3 years, and you need a colonoscopy in 1 year. So it sort of spells out what's going to happen medically. And then the third part, what patients are asking for is, now that my treatment's over, what can I do to promote my own health or decrease the chance of the cancer coming back? And a lot of that has to do with health promotion, like if you're a smoker, quitting. If you don't exercise, become more physically active. And if you're not eating a relatively healthy diet, you should start considering doing that. And also looking at how much alcohol you're taking in. So if you look at those 4 health behaviors and make whatever modifications are necessary at the time, then you'll be doing the most you can do to live a healthier life.